Hello, welcome to the Rule Breaker Studio. We're so excited to be chatting with Rachel Malloy today from Nurses in Media. So, Rachel, I'm really going to quickly toss the floor to you. I'll just share. I have known Rachel for quite some time now, and we've had the great opportunity to collaborate on multiple projects. So, I'm really excited to have you here to really share about your passion. And let's just jump in. Tell us a little bit about who you are, and then we'll jump into the conversation.
Sure. My name's Rachel Malloy, and I've been a nurse since the 1990s, a long time. And I started my nursing career in a 32-bed general ICU. We took everything. This was before you had specialized ICUs. And I just gravitated towards neuro. So I really am a neuro nurse and have worked in multiple roles clinically as a code neuro nurse, primarily for stroke care, diagnostic medicine with neuroimaging. And I found my way to medical device. So I now work for Natus Neuro. It's a medical device company, primarily neurodiagnostics. And I've been there for 7 years and super happy to do that. But through my career, I'm not really good at sitting still. I'm a little bit of an internally restless person. So I continued to find myself going back to school or doing a fellowship. And then I ended up in a DNP program. And now I have this brand new passion around nurses in the media, and which is why I'm here to talk to you today.
Okay, so I'd love for you to tell us just a little bit about this passion project, maybe how it unfolded and where it's at today.
Sure. So it all came about because I am not a traditional DNP student, or I wasn't a traditional DNP student because I didn't work in a clinical setting. So I had to come up with a project that was different. So program development worked perfectly for me. And I was really inspired by the Woodhull study when I learned about that in the advocacy and ethics course, or we took one semester. So that kind of spoke to me, particularly because they deemed out of that Woodhull study, which was in 1997, but they deemed that nurses were healthcare's invisible partner. And I thought, no, we're not. You know, I'm kind of a hold my beer kind of person, right? And see what I can do. So I that just sat with me in a way that just did not feel right. And so I thought, well, there's got to be a way for nurses to be more visible in media, and more literature was coming out about the importance of nursing and leadership and media training. But the gap is there is no training for nurses. There is no program out there specifically for nurses. And so I thought, that's my project. That's the gap that needs to be filled. So I developed a media competency training program. And I was very fortunate because the 10 competencies for nurses just had been published by Carol Myers, and that was in 2022. So I was able to use those competencies and build a program right off of that.
Okay, well, that's awesome. So I think you're talking to two of the queens of hold my beer and watch me work. And so I think we're in good company from that standpoint. So I really love what you're saying about how you identify, like, okay, nurses are way more than what they're trying to categorize us at, right? Especially with our influence over healthcare. And I love partnering that with media because I myself am also very passionate about media, not necessarily like news media, but like social media and how we're able to engage nurse leaders in that work. And I think oftentimes nurses don't see that that's part of their role, right? Like that's something that you need to be doing. And maybe it's because you identified this gap in that we don't have any training. But I just wanted to just call that out because it just really spoke to me.
Yeah. And Rachel, I'm just curious, like, what would you say are the top 3 nuggets of, if I'm not taking your course today, which I would love to hear more about what that looks like, what the top 3 might be, because along those same lines, I'm super passionate about our voices getting out there, but it's not always beautiful and professional coming across. And so that's a big part of why Alyssa and I are doing what we're doing with this podcast. There's so much work going out there, and it does feel like it's a little bit invisible. So how do we elevate those great things that are going on out there? What would be those top 3 things that we can do?
Yeah. So I think once that you have said, all right, I get it, I want to be part of the change, I want to be the nurse that's part of this change, then the number one thing I think is creating a concise message, being able to identify what it is that the interviewer or the paper or radio station or whatever that you're interviewing with, whatever it is their scope is, what it is that you want to say, and then what the public wants to hear, and then figure out what those 3 key messages are, and then stay with those points. So that's number 1. Number 2, you don't have to answer every question that's asked of you. And I think that that's a thing that nurses really have a bad habit of doing, right? Just, oh, you asked me a question, I got to answer it. No, you don't. You can just pivot away and go back to your 3 key messages, because that's what you really want to try to get across, right? You're using media as a form of public health communication, and also being able to raise the visibility of nursing at the same time. And then the third thing I would say is, not everybody's experience with media or their path with media is going to be the same. So some people are really going to go down social media. Some people are going to be like, I just want to do broadcast media. I want to work with a television station locally. I want to be their nurse healthcare correspondent. That's great. Some people are like, look, I really feel comfortable writing. Maybe I'll have a blog. Maybe I'll write for my local magazine of my hometown or whatever, write letters to the editor. There's lots of different forms of media that you could do. Like you guys have a podcast. Like how amazing is that? So everybody's going to find a media form that speaks to them, but it's going to take all of us collectively to make the difference. And there's 4 million of us nurses, so we can do it. I know we can do it.
Oh gosh, you just said, that's my goosebump moment for the day. I always am talking about how we remember when they did the doctor's stethoscope on The Voice, and we rose up in anger, or we shut down Amazon sending playing cards to a senator. And I'm like, what if we use that power to do something really meaningful?
Exactly. Exactly.
Okay, so in what you were saying, I just want to kind of go back to, you were talking about you don't have to answer every question. Mm-hmm. So, and you can stick to your messaging. And what the first thing that popped into my mind was, oh my gosh, how you couple this training with how nurses already advocate and how you can translate that advocacy. Because I mean, when you're in the hospital, and we're going to take it back to the clinical setting, because that's where I'm a nurse. I always take everything back to the clinical setting and how it relates. So I'm thinking like, okay, like you have 2 things that you want to accomplish for your patient that day, and you're not going to give up. You're not going to, get strayed away from those 2 things that need to get accomplished from your patient that day, and how you're going to advocate and get those things accomplished. And I think of the same thing, but in a more global perspective, right? Like, what are the things that have value to you that you see maybe need a change, or maybe need elevation, or maybe need communication, and tailoring those out for yourself and kind of pushing those momentum, giving that some momentum and putting that out there to the public. And really just that small step of determining what's your message can send you on a massive journey. I think about that even with the 3 of us, right? Like, Rachel, you got passionate about nurses in the media, and now your message is elevating how nurses learn to be part of the media. And it's blossomed into this, this project and into collaborations with organizations, and developing this course. So I just want to really empower other people to kind of listen to what you've said there, and really develop what is your own message and what is it that you want to share, because having that identified, you don't know what you might turn it into. I mean, it's just amazing to even think about. So I love the golden nuggets and where it took my little brain there.
Yeah. And I think if nurses stick with just this concept, right? Public education, just basic healthcare public education, that is going to be the most powerful thing we can do. Because think about it. Even if you go to the doctor, like, annual visits, just like you're supposed to, you get 15 minutes if you're lucky with your healthcare providers. So where's the community supposed to get all of this information? And oftentimes some information that's out there is incorrect. So there's an opportunity to bust some of those incorrect ideas and give true evidence-based information to our communities. But it could just be simple things like, I'm a neuro nurse, so I'm always going to go back to the brain, but think about traumatic brain injury, right? The number 1 cause of traumatic brain injury is falls. The highest risk group is over the age of 75. How many people right now are taking care of their parents that are wanting to stay in their home, but they're worried that they're going to fall, maybe what they need to do is just give some tips on how to keep your parents safe at home, right? Make sure that there are no area rugs. Make sure that there's grab bars in the bathroom or in the shower. Simple things like that is what the public needs to hear. And where else are they going to get it? So speaking of that, I'm so excited about this. So I'm just going to share it while I have a platform for it. But myself and 3 other neuro nurses have started a social media page. We're on Instagram and Facebook called Ask the Brain Nurse. And we just launched last week, so we don't have a lot of content, but we are going to actually put those kind of messages about brain health, health prevention for the brain, neuroeducation out there for the community. And it's been great. People are starting to engage with the posts, and we're getting questions asked that we're going to answer in upcoming posts. So it's completely doable thing, and it's not hard, and it's actually fun, and it's going to help a lot of people.
I love this. I think
I was like so excited just hearing about it.
Truly, I think we take for granted all of the knowledge that we have, the things that sound so simple. Like you said, remove the area rugs, have the handrails in place. We're trained to look at those things and we take for granted. And people come into the hospital. I'll never forget. It was a stroke patient, and the family member found them out back and said, she didn't seem right. I put her in the bed for a few days. And then when things didn't get better, I brought her in. And I thought, oh my gosh, we have got to do a better job educating the community. And it's those things that make a difference. So Rachel, I'm curious, where can we start this work? Because I'm hearing you talk about it, and I'm always looking at a lens of leadership development. And I'm thinking one of the toughest things for a leader, besides finance, is always difficult conversations. And it comes back to those same 3 things, like come in with your key points, know what you need to talk about. Don't let you get deviated from the point at hand. But where can we start this? Like, does it go to school? Does it go to someone else? Where do we start?
Listen, every professional nursing association, I'm going to start that with the word professional nursing association, is there to represent their specialty and to represent their nursing community. I think it starts there. I think that every professional nursing association needs to have a media engagement plan. They have a responsibility to it. Media is not going anywhere, right? Like, we can pretend like it's not, and we don't want to do the media. It makes us uncomfortable, but it's not going anywhere. And if you're going to be a professional association and you're going to be a leader in a specialty for nurses, or as a state association for nurses, you've got to have a media engagement plan. Now, that doesn't mean it has to be the same for every single association, but you can decide what's going to be best for yours. But what a better way to elevate your specialty and your nurses than to allow them a platform to provide, to speak using media in whatever form you want to speak using media to elevate that association itself, right? And oftentimes people are like, how are we going to get to more nurses interested in being nephrology nurses or neurology nurses, right? Well, people want to see them. And that brings me back to I'm just going to go there. I haven't told this story publicly to anybody yet, so it's the number one place to do it at, but it was the media that actually got me into nursing. So I was an adult, I was a single parent, I was working as a waitress, and I'm like, I have got to figure out what I'm going to do when I grow up. And so, you talk to people and they're like, what really interests you? Well, I lived in Kansas City at the time, and on every Sunday in the Kansas City Star, there was an article about healthcare, and they taught you something new about some kind of disease process. And every Sunday I'd get the paper just to read that. And I'm like, this is the thing that interests me. So it was actually media that brought me to the nursing profession to start with. I know that seems really random, but I'm kind of making a full circle.
Yeah, full circle.
And I just feel like that can happen with other people. If nursing associations would make a commitment to a media engagement plan, whatever that might look like. And I would love to help any association do that if they're interested.
Okay, so I want to circle back. I want to talk about 2 things that you've shared. So the brain nurse, I know I'm butchering that because you just
Ask the brain nurse.
Ask the Brain Nurse.
Mm-hmm.
So one, I just want to call out how empowering, to leverage your nursing knowledge in support of the public. And I think that's one of the things that, really has come across today in our conversation is how valuable that knowledge base really is and what you can do with it. You can really do anything with it. It's just about what you feel comfortable with. So I really want to call that out. I think that's a very, very important work that you guys are going to be doing there. The other thing is, when it comes to when I think about engaging in social media, sometimes when we're with organizations or we have, our employer may not be so excited about what we share. Are there any strategies that you found, like when people are maybe engaging with the media or not, or, reasons why they may not be, like barriers, anything that you found that can help you overcome that?
Yeah, that's a really good question. So, first of all, HIPAA is always in place, but I don't think nurses need to tell patients stories to provide education to the communities. And our knowledge as nurses is ours, right? It's ours. We learned it, we went to school, we paid for it, it's ours. And our experience is ours. And so I don't think there's anything wrong with a nurse sharing their experiences or their knowledge, like a simple thing, pick up the area rug so that your parent doesn't fall and break a hip, right? Like, what's wrong with that? How can anybody be mad about that? But I also think it starts with having conversations with your hospitals, right? So you go to the public relations department in your hospital and you say, I really feel passionate about this. I feel like nurses, we know for a fact evidence is out there, nurses are missing in the media, and I want to impact that. And I've taken a media training course. How can I help this hospital get some messages out there? And I think the more nurses put themselves out there and start having those really respectful conversations with good intention, I think we'll start moving the needle a little bit. So that's what I would do.
I like that. We do tend to get really risk adverse when it comes to this. And many organizations I watch come through in various ways of what's your social media policy? And so many of them are don't, or make sure that you say, by no way does this represent this organization, all of these things in place. But we watch what's happening out there. And there's a lot of messages going out that don't look very becoming of our profession, and we're not equipping the people to do it in a way that is meaningful. And so rather than put all this red tape down and say, just know it's okay, this is happening, right? Alyssa, you said it. It's not going away.
Yep.
How do we help people do this in a way? And I love the work that you're doing to help elevate the voice of the nurse out there.
The gap is the training is missing. I mean, that's the gap. If there were training, if media training was a portion, just a portion of every leadership course in every aspect, academia, healthcare organizations, professional nursing associations, we would begin to normalize the idea of nurses being in the media. And I think that is really the best first step to do that. But you got to have those training things in place so that you know how to do it. I mean, nobody knew how to, the first time you start an IB, like you had to learn how to do it. Nobody came, just grew up knowing how to do that. You had to learn how to do that. And it was uncomfortable, right? You're like, oh my gosh, you don't want to hurt the person or whatever. Well, it's the same thing with media. And I've been subject to that. I actually turned down an interview because I didn't know what to do. This was before I developed a media training program, because I would never do that now. But I turned it down about something I felt very passionate about because I wasn't comfortable being uncomfortable. And I wasn't sure what to say, and I didn't want to look foolish. Well, now I know exactly how I would approach an interview like that. I know how I could do a 30-second public service announcement and really speak to the thing that I'm passionate about. So, I would hate for any nurse to have that same experience where they have the opportunity and they shy away from it because they just don't know or they're not comfortable doing it. So I've been teaching media competency training at Wake Forest School of Medicine in their academic nursing program to DNP scholars. And we actually collected some data over a couple of semesters. And what we found was that nurses, after the training, they feel more comfortable, they feel more confident, and they feel like their skill set has improved. So I know that the training can help nurses get there. And then oftentimes I get an email that says, Dr. Malloy, I got an opportunity to be on a podcast, or Dr. Malloy, you know, you're not going to believe this, but they've asked me to write something for my local paper. And so that just makes me really excited when I hear those things.
Okay, so it has been an absolute pleasure chatting with you today on the Rule Breakers. And I do have to tell you, we have one question for every rule breaker that we welcome to the club. And it's, if you could break any rule in healthcare, what rule are you breaking?
Well, I don't think I could come up with something really, you know, out there, but the truth is that I'm doing it. I am breaking the rule. I am speaking about my knowledge about nursing, my experiences with nursing. And I think that every nurse should find a way to try to break that rule respectfully without getting in trouble.
I love it. There's the risk adverse part of the nurse that that came out in there. I love that. So last thing is, if anyone wanted to get in contact with you, talk to you about maybe having you do a training for them, their nurses, their organization, how are people connecting with you? How are they finding out more about your course?
Absolutely. So I'm happy to talk to anybody at any time. I'm happy to come speak at your conference. I'm happy to do a workshop for you or talk to you about developing the video training program into your organization. So they can reach me at Nurse Malloy, Malloy, at nursesinthemedia.com. You can also use the contact me page through my website, which is nursesinthemedia.com. Real clever there. And I'd be thrilled to hear from people. So give me a holler.
Are you on, is there any preference in social media site? I know you have the separate group, but is there any preference in like personal social media where people can contact you?
LinkedIn is a really good place. I'm Rachel Malloy, RN is my my line, so you can reach me that way too. And you can follow the Ask the Brain Nurse on social media, and always reach out that way too.
All right, perfect. Well, it was wonderful to have you on the Rule Breakers today, and welcome to the Rule Breakers Club.
It was a pleasure talking to you. I'm going to take away, I always say, get comfortable being uncomfortable. That's where the growth occurs. But I think I'll add to that, hold my beer.
Yeah. Oh, ladies, thank you so much for having me today. It was thrilling to talk with you.